Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
Hi, I'm Melanie Lawson, host of MedAxiom HeartTalk, and today we are joined by Martin Shirley, President and CEO of TTG Imaging. And today we are talking about cardiology in terms of modernizing nuclear cardiology departments. So welcome to the show.
Hi, thank you.
So what does that look like from your perspective?
It's interesting. I've actually been in nuclear medicine, nuclear cardiology since 1985. Today's the most exciting time we've had in our industry. Almost back to like in the 1990s when we first started bringing nuclear cardiology into private offices, right? So today's iteration is we've made a great investment as an industry in having a lot of SPECT myocardial perfusion imaging nationwide, great access for patients, excellent outcomes for patients, but now it's time to step things up. Today, we can do that through upgrades on systems that physician practices already own, so we can bring new life into those systems with new algorithms, new processing, better outcomes. We can also do upgrades where perhaps we trade out a piece of equipment for a new, more modern technology based on solid state instead of tubes. We have systems at TTG where you have an application of a CT approach to attenuation correction for SPECT imaging. That means clearer images, more confidence as a reader, less false positives, great outcomes for the patient, right? We also are at a point where the industry has accepted and grown the use of PET-CT technology, another awesome piece of advancement in our industry, better outcomes, less false positives. These are all great things for patients, right? And so with our company, we can provide all of these things. So our opportunity is to have the chance to sit with practices, their nuclear cardiology departments, audit, if you will. Where can we help? How can we help? Because we can do all of those things. And it doesn't matter which brand a physician is invested in.
Right,
we can touch all of them.
Wow, all right. So how do cardiologists kind of make that decision on how to maximize the role of SPECT MPI in their practice?
Well, I think the first thing is, as an industry, we have to accept that SPECT MPI is not going away. PET-CT has its role, right? Just like stress echo has a role, and treadmill stress tests have a role. SPECT imaging is here to stay. What we're going to be able to do as an industry when we have availability of all these tools on an equal basis, we can pick the right test for the right patient and the right time, and also for the right reason. Right. So for some patients, SPECT MPI is the right thing to do. Ideally, with something that provides you with attenuation correction, because that's the best possible image for SPECT is with attenuation correction. And other patients, they're best served with PET-CT, because you get the perfusion imaging information, but you get additive information about flow and flow reserve and all of these more advanced features that you're never going to get from SPECT. So it's really about what do you want to do with your practice? How do you want to approach your decision making on imaging, which then begets decisions on how do we handle patients, which is why we're all here.
Right, yeah, for sure. Always patient-centered. There's a lot of interest within cardiology about PET and PET-CT. Is now the time to kind of make that leap and start offering PET or PET-CT imaging?
Oh, I absolutely believe now's the time. We've had a large number of practices across the country that have already stepped into the waters, and they're wonderful. The waters are warm, it's delightful. Right. Most importantly, it works, it fits. It fits within a cardiology practice. It fits within the scope of care, and it benefits the patients, which again, that's why we're here. The reason why I say today is the time to do it is those early trailblazers have proven the model, and now it's time for the rest of cardiology to accept this and say, this is our new go forward. How do I do that? And that's the key. How do I do that in my practice? It might be different than yours. Right. And that's why one of the things that we're working with from our company's perspective is helping physicians make the decisions of how do I do this? Where does it fit? How do I care for patients? It's not just, hey, we have this thing, would you buy it from us? It's how do we help you run your practice optimally? Now's the time because reimbursements are right. Access to the rubidium radiopharmaceutical is here today and real. It can be used on a fractionated basis. There's a company out there that does it. We don't, but there is a company that does that. And then new imaging agents like Flurpiridaz will be released probably within the next 18 months, which just increases access and availability. And when you have access availability as a physician practice, you can find a way, and we can help them.
Yeah, and customizing that plan, for them
Always.
specifically.
Always.
So what are the key things that cardiologists need to know before they decide to offer this?
I think first they need to understand what is their imaging strategy, right? This whole portfolio of modalities.
Strategic
What
planning.
is their strategy, right? How do we approach patient care? It's delivery of healthcare, and imaging is a subset of their plan, right? So when they understand that, we can come in and sit with them and help them understand perhaps decision pathways, decision trees, which patient is best served with SPECT, which one is best served with PET-CT, right? Which one of those really are you going to make clinical judgments on? And then you have to start looking at the business side of things, right? What is my patient volume? If I have my theoretical flow of patient decisions, what do my percentages look like? At the end of it, how many a month do I think I would do with PET-CT versus SPECT versus this versus that? And when you understand that, we could say to you, okay, here's the investment you should make in SPECT to modernize. As far as PET-CT goes, this is what you're going to look at, but it becomes philosophical. How do I handle patients? What decisions am I trying to make for their care? Volumes, and then we can help with pro formas around the financial return, the business aspect.
Yeah.
But you have to make the clinical decision first.
Yeah. All right. So in order to offer cardiac PET-CT imaging, what are the most important considerations for cardiologists? And you kind of touched on that, looking at those key things before you make a decision that you all sit down and talk with them about.
Exactly. Once we can help the physicians understand the baseline, that's what I think of. Here's our baseline. Now what do we want to do? How can we get there? Because there's so many choices. Some of them could be bad for certain practices that might be good for others. So it really is customized to the practice and their patients. But when you think about it, there are space considerations. PET-CT machines are rather large. You're looking at a 15 to 17 foot wide by 25 to 30 foot long room. That's a big commitment, right? There's construction to be done. There's shielding to be done because of the CT device. There's radical materials licensing regulations. There's accreditation to be done. All these things our company specializes in. Again, we're not here to sell a machine. We're here to create a solution, right? And the solution always has to include, well, how do I really do this?
Right.
It's not just sign this piece of paper and buy this machine. No. That's easy.
Right.
How do we really do this? And then, with our company, we employ over 175 nuclear medicine technologists. So if you have a clinical need, you don't have staff, fine, I can include staff. Again, this is about how do we solve the riddle of how do you do PET-CT in your practice.
First starts with that conversation.
Always. And the willingness to have the conversation.
Right.
To remember, as a physician practice, I'm busy running a medical practice. I'm busy making decisions about patient care. I'm not an expert in this, but companies like us, this is what we do. We're experts. Please have the conversation. We're happy to tell you, hey, this doesn't work. It's not for you. We're happy to tell you how you could do it.
Right.
And how to do it optimally.
All right. Martin Shirley, President and CEO of TTG Imaging. Thanks for coming on Heart Talk.
Thank you.